Hello everyone, my name is Riya Datta. I am a health coach at Besugarfit. So today we will be talking about ways to prevent pre-diabetes or early stage diabetes. Pre-diabetes or early stage diabetes is a serious health issue that should be taken proper care of at the earliest. If neglected, it may turn into diabetes, which can result in various health fatal problems. If a person's blood glucose level is higher than normal range but not so high as a diabetes patient, then this health condition is termed as early stage diabetes or pre-diabetes. Both children and adults can be affected by this ailment. Moreover, if a person suffers from pre-diabetes for a very long period of time, then some important organs like the heart, kidneys may be damaged in the same way as it is seen in the case of type 2 diabetes patients. The cause of pre-diabetes are almost similar to those causing type 2 diabetes. Insulin resistance causes pre-diabetes, resulting from metabolic disturbance in the body. So the symptoms of pre-diabetes are continuous tiredness, increased appetite, frequent urination at night, blurred eyesight, numb feeling on the hands and feet, lateness in wound healing, unplanned weight loss of the body, darkening of the skin on neck, armpits, knuckles, elbows, etc. Most of these symptoms are common or same as those of type 2 diabetes. Hence, it becomes difficult to differentiate between two conditions unless a thorough blood checkup is done or a blood test is done. First is cut down on your sugars and refined carbohydrates. When a person is diagnosed with pre-diabetes, should avoid sugary food items. They should avoid too much processed foods or refined foods that can increase the blood glucose level. Complex carbohydrates are not easily absorbed in the body cells as they break down very slowly. On the contrary, refined carbohydrates quickly break down to glucose and hence absorbed by the cells very quickly. Hence, it is best to avoid processed sugars, syrups, white rice, white bread, pasta, and breakfast cereals, and also refined rich carbohydrate sources. Too many sugary items like pastries, carbonated soft drinks, jams, juices, candies, and sweets are also to be eliminated from the diet. Second is healthy diet. An ideal diet should consist of or comprise of whole grains, lean meat, fish, less sugary fruits, and fresh vegetables. It is better to consult an expert to take an advice on how to reverse pre-diabetes condition by taking or having healthy meals daily. Foods with a high glycemic index can increase the blood glucose level. Hence, it is always recommended to eat low glycemic index foods like whole grain bread, carrots, beans, sweet potatoes, leafy vegetables, oats, and corns. Fiber-rich foods are always desirable in this case, among which legumes, fresh fruits, vegetables are preferred. Lean meats, egg white, shellfish, soya bean products, low-fat yogurt products are very good source of protein and can be included in the diet. Third is quit smoking. This is one of the major important points. because the effect of nicotine in the body can increase the blood glucose level. Insulin becomes less effective in lowering the blood glucose level due to the presence of nicotine in the body. Hence, the regular smokers face a greater threat of being infected with prediabetes. It is seen that insulin regains its usual function after 8 weeks from when a person quits smoking. Fourth is staying active. The habit of regular exercise is the best way to decrease the body's blood glucose level. It is seen that the lack of physical activities can lead to worsening the symptoms of prediabetes. The insulin resistance of the body cells can be decreased only through a daily exercise regime, as mentioned by the doctors of National Institute of Diabetes and Digestive and Kidney Diseases. After a vigorous workout session, body muscles consumes more glucose to be energetic or to stay energetic. However, cardiac patients cannot do strenuous activity which can harm their health. They can only go for daily morning or evening walks, dancing, swimming, and cycling. It is recommended to work out at least 30 minutes per day, 5 days per week. Fifth is staying hydrated. Everyone needs to drink sufficient amount of water daily to keep the body cells accurately or adequately hydrated. Staying hydrated is most important for patients suffering from prediabetes to remain healthy. They should drink normal water instead of soda, fruit juice, or other sugary drinks to quench their thirst. The ideal amount of water intake for a person depends upon its height, weight, lifestyle, and climate. The frequency of urination of the patient should also be considered so that the amount of water they should be consuming per day can be determined. The 5 ways that has been discussed in this session has to be followed every day and regularly, because the body likes to get into a rhythm, and when it is in a smooth flow every day, the body tends to form this as a habit, and when it is a habit, the body will work in a positive way. Thank you.